Okay, so a
Absolutely.
lot of people are receiving these therapies, and in combination with chemotherapy, because the next question that I have is how do you know if chemotherapy is working?
Mhm.
I and what happens if it doesn't respond? And it sounds like maybe then you do a partnering agent, or I believe at the beginning when you were talking about early stage disease, that chemotherapy in TNBC is often done before surgery, so you can monitor its effectiveness.
Right.
Yeah.
Yeah, exactly. So it's a it's a slightly different paradigm depending on which situation we're talking about. In metastatic triple negative breast cancer, actually in any metastatic breast cancer, once we've started a therapy, we want to keep a close eye on how it's working. Sometimes we get really quick indications, like somebody feels better, right? When their cancer's under better control, symptoms can improve, right? Pain can improve. The need for pain medications can come down. That's an early indication things are working. And sometimes there are blood markers that can be an indication that the breast cancer is getting better, whether that's abnormal liver numbers start to improve, or a tumor marker like CEA or CA15-3, which is in the blood, starts to come down if it was elevated before. So that's all great news. Generally, in metastatic breast cancer, about every 3 months, with triple negative, about every 3 months, we would repeat scans. And that can be either a CAT scan of the chest, abdomen, and pelvis with a bone scan to monitor response, or a PET scan, kind of a head to toe look on imaging of how the tumor is changing with respect to the scan from 3 months prior. And what we're hoping for, obviously, is that things have shrunken down, or that spots that were there before have disappeared. But even if things are totally stable on a scan, that's a success, because the natural history of the breast cancer is that it would want to grow, or it would want to show up in another organ. So if the therapy that you're on for metastatic breast cancer is tolerable and you're feeling okay and everything is stable and quiet on a scan, that's a win. And I would keep on that therapy and repeat a scan again in about 3 months. In early stage breast cancer, when someone has gone to upfront surgery and the tumor is removed, we call chemo after that adjuvant therapy. And there really isn't any way to monitor if that adjuvant therapy is working. Um, there's no tumor to monitor. There's nothing to feel or see if it's changing. The cancer is out of the body, and that adjuvant chemo is really a prevention strategy. It's treating on faith in case there's something hiding out somewhere to prevent a recurrence later on. Where there's an opportunity for monitoring in early stage breast cancer is when chemo and immunotherapy are given before the surgery. And often there, you can see and feel the tumor within the breast shrinking down. Or when women have had some skin changes over the breast, redness or dimpling, you can see that improve. And many times, women over the course of those 5 months before surgery will find the breast mass has disappeared altogether. And we will often image right before surgery then with a mammogram and an MRI to help plan for surgery. And many times we see that imaging has completely normalized. Ultimately, you know how well the chemotherapy worked when you go to surgery and the pathologist looks under the microscope and will tell you whether there is any bit of invasive breast cancer remaining. With the regimen I mentioned to you, that incorporation of immunotherapy and chemo in the pre-op setting, the likelihood that everything has disappeared is about 60 something percent, maybe about 65%. So odds are very much in women's favor that the breast cancer would disappear from pre-op therapy. And in contrast, for women with hormone positive breast cancer, the tumor disappears with neoadjuvant therapy only about 20% of the time, or 25% of the time. So this is a place where triple negative breast cancer actually performs much better in response to chemo and immunotherapy.